Hi there, this is Dr. Chung. Today I'm going to go over some of the main points of guidance that I go over during the 9-month-old well child check. As far as feeding goes, the number of times a 9-month-old typically needs to be offered milk, whether it's via the breast or bottle, is approximately 3 to 4 times per day, when at a 6-month-old we estimated approximately 3 to 5 times per day. We expect gradually from 6 to 12 months old, as the child gets older, that solids gradually become a bigger part of their growth and calories. So they don't need to drink as much milk as compared to when they were younger, less than 6 months old, when they weren't eating much solid foods. And there isn't a specific number of ounces of breast milk or formula that you should specifically target. You can continue to offer approximately 3 to 4 times per day and let them regulate how much they want at that time. Now, the best way to do that would be to offer solids more and more frequently as they get older. So I say by 9 months old, I would recommend offering solids at least 3 times per day. And from 9 months until 12 months old, as they get older, I would recommend at some point adding 1 or 2 snacks. So 3 meals, eventually add 1 or 2 snacks, because we want to give the child, as they get older, more and more chances to get used to solids, and they don't need to eat a lot at every meal or snack, but just to give them more chances to get used to different foods and gradually eat more and more. Always offer the solids before the breast milk or formula, so that the child is hungry and will eat as much as they want of the solids. The solids are very calorically dense, have a lot of great vitamins and nutrients and proteins and healthy, important things like iron. So if they eat a lot of solid foods, and therefore when you go to offer milk afterward, they don't drink as much milk, then that is not problematic, because again, the solids are very important for growth and very calorically dense. So those children tend to grow well. We want to continue to avoid offering milk before solids, because that will impair how hungry they are. And so we don't want a lot of milk before meals or snacks to decrease how hungry they are, and therefore decrease how much they would eat. If there are certain times during the day when the child wakes up in the morning or wakes up for a nap, and then they drink a lot of milk right away, and then the meal or breakfast or lunch is about an hour later, sometimes that can work well. But in general, I say as time passes, try to switch that order. Let's say a child wakes up, their mouth is dry, they're a little bit thirsty, then have them have some sips of water, and then give the breakfast or lunch first, and then wash it down with milk, is better than milk and then a meal 30 minutes to an hour later. Until 8 months old, we say for safety reasons, keep the food mostly soft and pureed, although you're allowed to do some baby-led weaning strategies where a child gnaws on some piece of food, as long as some piece at the end of it is not going to break off and cause a potential choking hazard. So keep it mostly pureed until approximately 8 months old. And at 8 months old and up, then a child's swallowing coordination is improved. So then it's allowable to give some soft, small finger foods that aren't too chunky. So things that you would still want to avoid after 8 months old are things like raw apple chunks, raw carrot chunks, pieces of hot dog, since it's rather firm and rubbery, grapes that aren't cut up into super small pieces. So you still want to avoid larger, firmer things like that. Things that are safe to give your child as far as soft finger foods go would be softer, smaller things like scrambled eggs, soft pastas, soft bread, uh, well cooked meats, or some soft cheeses that are diced up into really small pieces. And if someone were to ask me, like, how small should the pieces be, I would say, in general, at this age, the softer the better, since they can't really chew the food. So maybe pieces less than the size of half a centimeter. As the child gets older, the amount of milk that we expect the child to drink as they approach and get close to 12 months old is approximately 16 to 24 ounces per day. Not that you have to measure it if you're breastfeeding and just offer it the number of times that we recommend, but if you're doing bottle feeding, then we expect that the total volume of milk per day to trend towards 16 to 24 ounces per day as they approach 12 months old. And that's just another way of saying they don't need to be drinking as much milk if they're eating more and more solid foods, which is what we want. There isn't a specific amount of water your child is supposed to drink at this age. It depends on it depends on different things. Like if there is some firmer stool and constipation issues, then giving more water can help that. If it's very hot outside, then giving a little bit more water can supplement the hydration in addition to the water that's in the breast milk or formula. So I would say it's a balance. Some water is good for hydration and preventing constipation, but too much water can impact weight gain. So if I had to give a rough estimate, it would be anywhere from approximately 1 to 10 ounces of water per day, but the right amount would depend on the specific needs and growth of your child. As far as sleep goes, a child of this age, cumulatively per day, is expected to sleep 12 to 16 hours per day. So we want a child to get added up the nap and the nighttime sleep to be at least 12 hours per day. A child is usually taking anywhere from 2 to 3 naps at this age. And at night, about half of babies can sleep approximately 8 to 10 hours through the night without needing to feed. And of course, that's contingent usually upon that you've done sleep training at bedtime and through the sleep regressions, which can commonly happen by this age. And if your child is doing a little bit less than that, as far as not doing quite 8 to 10 hours at night by this age, if you haven't done sleep training, that can help. Or if your child's weight is a little bit on the lower side and they need to be fed a little bit prior to 8 hours, then that's not abnormal. And if your child is able to do more than that, then that's usually a sign that they're well fed and maybe the sleep training was extra effective. And so it doesn't have to be within those number of hours, but that's the typical range that we expect, is being able to sleep 8 to 10 hours through the night if you've done some sleep training without needing to feed. And if your child is growing very well and the weight gain is very good and they are starting to wake up after bedtime, after 3-4 hours when they previously slept much longer, then most of the time it's going to be a behavioral sleep regression where they just need to be trained to go back to sleep on their own without you intervening and doing things like feeding them to sleep or rocking them to sleep or bringing them to your bed. So it's recommended to do some additional sleep training strategies like you did initially whenever you sleep train them if they're having those behavioral sleep regressions. A child will start teething usually anywhere from around 5 to 13 months old. There's a large range of when that can happen. So if your child is starting to have teeth at this age, then it is recommended to start cleaning them. So we recommend cleaning your child's teeth twice per day, morning and evening. The most important, I would say, is at night after the last milk or meal. And if the teeth are barely in, then it's okay to use a washcloth or a soft toothbrush. And again, the official recommendation is to use some toothpaste with fluoride. There doesn't need to be a specific brand. Even an adult brand would be okay. But because your child can't spit it out, we say use a very tiny amount, so a rice grain sliver amount of fluoride toothpaste. And we recommend that a child sees a dentist for the first time sometime after 12 months old. As far as developmental milestones go, these are some of the milestones that we would look for at 9 months old. As far as motor milestones, what the expectations are is that 75% of children will be able to sit up well on their own. They're grabbing things and trying to bang them together. Some of the language and social milestones would be things like laughing and smiling when you play peekaboo. When you say your child's name, they seem to understand and are looking at you when you call their name. Some of the developmental milestones that we would expect for a 9-month-old are, as far as motor milestones go, being able to sit up well on their own, grabbing things and trying to bang them together. Fine motor milestones would be an immature grasp, and again, being able to pick things up, but not necessarily expected to have a mature pincer grasp yet that would be closer to 12 to 15 months old. And some children are expected to start doing an army crawl type of event at this age, but I would say that that's pretty variable in my experience for normal children to sometimes skip that crawl phase and go directly toward pulling the stand and cruising at approximately 12 months old. So if all the other motor milestones that I mentioned are occurring, or your child is doing that, but they're not doing a lot of creeping, which is on all fours, or if they're not doing any type of army crawling yet, then that is not necessarily abnormal. And the social and language milestones would be things like laughing and smiling when you do peekaboo type playing and turning their head when you say their name. There aren't standard vaccines that we give at 9 months old. There are optional vaccines like the COVID or flu vaccine if it's the appropriate season for those things. We at our site do a finger prick blood test at this age, which typically it's recommended to do it at 9 to 12 months old. So we do a finger prick blood test that checks for lead levels and hemoglobin, which is a reflection of if your child's getting enough iron in their diet. Those are the main points of guidance I like to go over at the 9-month-old checkup. And then the standard next checkup after that is the 12-month-old checkup. So we'll plan to go over those topics during the next video. Thanks, everyone.